Okay, welcome everybody. Thank you for joining us this afternoon for Wayne Law's fourth town hall on the COVID-19 pandemic. This week, we're going to be talking about structural racism and COVID-19 and the social and economic determinants of health. We're joined today by Peter Hammer, the A. Alfred Tellman Endowed Chair and Professor of Law at Wayne State University Law School and Director of the Damon J. Keith Center for Civil Rights. Before I hand things over to Professor Hammer, I just want to go quickly over a couple of housekeeping rules. First, please keep your mics muted. Second, we found that a really good way to submit questions for the Q&A is to use the chat feature. You can do that at any time during the presentation. If you have a question, just drop it into the chat and I'll monitor that. And at the end of Professor Hammer's presentation, I'll read out the questions for him to answer. And I think that's it. Peter, please take it from here.
Great. Well, thanks everybody for showing up in our virtual discussion of COVID and structural racism. I'm going to have a PowerPoint presentation, right? And I'm going to go through it fairly quickly, but if people want slides, I'm always happy to share. And then we'll have the Q&A discussion and see where it goes from there. So I'm going to try my screen sharing. That's not working. So let's try that one more time. Where I need to go down and say more. Then we'll start from the beginning. So we're looking now at COVID-19 and structural racism, but the question that I want you to anticipate us getting to is what determines the social and economic determinants of health. If you've been paying any attention to the news, you already know the sort of statistical tragedy that COVID is revealing. That if you think of Michigan alone, African-American population constitutes roughly 14% of the population of the state, but constitute 32% of overall percentages of people getting the disease, and 41% of the people who are dying from the disease, right? And then you just start asking all these why questions. Why is that the case? Why is it disproportionately affecting the African-American community? And again, if you've been listening to the news, you hear sort of a handful of standard answers, all of which have some validity, but all of which only provide partial answers. One sense is that there's health disparities and that there's higher rates of comorbidities in the population, if you think of asthma or obesity or diabetes or hypertension. There's economic, employment disparities. African Americans are more likely to be in jobs that are viewed as essential, bus drivers, food service, and sadly are less likely to have the white collar jobs that can be moved online in a way that is safe and protective. African Americans are often more reliant on public transportation, have less access to health care, and we can kind of group into a whole bunch of economic disparities. Think about how it's more difficult to shelter in space in urban settings, and think ironically about how suburban space, and sometimes I think about suburban space as white space, is really designed for self-isolation. And it was designed for self-isolation before COVID, but it certainly facilitated the ability of a number of members of European descent to be sheltering in place in a more safe way. And then the evidence shows a whole lot less trust of the healthcare system. And you can think about a variety of history of civil rights violations going back to the Tuskegee experiments, to the fact that if you are African American, you're going to get less likely to be diagnosed for palliative care or have aggressive treatment on issues such as cancer or heart disease. Now, it's interesting because I gave many parts of this presentation as far back as 2016, and this is something we've been arguing at the center for many years. But you see how it really echoes in a world of COVID pandemic. And that's that the changes that are necessary to address structural racism are very similar to the changes necessary to improve population health and to make universal health care sustainable. And that public health provides a frame that can advance racial equity, and that racial equity, properly understood, provides a frame that can advance population health. And as we've seen through COVID, structural racism can function as a social MRI, starting to reveal the root causes of inequality and the impediments then of better population health for all of us. We often say here at the Keith Center that structural racism is a civil rights challenge of our generation. And also that the health sector may play as great a role in fighting structural racism as the courts did in the first civil rights movement, right? So there's a whole lot of reasons to think very aggressively that looking at health is going to be an important part of civil rights in the future. But you can't do that if you don't have a common analysis. And I've been very frustrated at the way many of the press and the pundits are covering the racial disparities of COVID, reflecting, in my mind, very narrow perspectives, either a narrow biomedical perspective or some pretty superficial analysis. And I say that the appropriate framing question really has to be what determines the social and economic determinants of health. And to think through what that means, it's helpful to kind of think of a health pyramid, right? In the very top of the health pyramid, you have the biomedical notions of health, right? That's your hospital, that's your doctor, that's your emergency room. Under that, you have notions of public health or population health. And it's amazing how poorly trained in public health most doctors are, right? So these are their own socialization. These are their own kind of little areas of siloed activity. And then very few get down to the social and economic determinants of health, right? But if you study population health, you start to see, well, it's not just the doctor. It's whether or not, what's your income level, right? What's the living environment? What's the surrounding air quality? What's your education level, right? What's all these social and economic determinants of health? And if you look at some of the studies, social and economic determinants contribute more than 80% of what makes a person healthy, right? So when we think about health, we're often thinking, again, in a narrow biomedical sense. And certainly when you're sick, you need to go to a doctor, and doctors are important. But healthcare in the biomedical sense really only contributes to about 12, 16% of what makes you healthy, right? So the big picture is down below. But even those members of the public health community that get down so far is to think about the social and economic determinants of health, they stop there, right? They treat those determinants as what an economist would say is exogenous variables. Those are just given, right? How can I change income? How can I change education? How can I change the environment, right? And the claim here, and this is where you see a merger of population health and civil rights, is that you have to, in this country in particular, have a sophisticated understanding of structural racism, racial equity to know what determines the social and economic determinants of health. So at the very bottom of the pyramid really is issues of structural racism that for more than a century have started to define the social and economic determinants of health that are now being revealed in the COVID crisis. So that's kind of the big framing. If you then say, well, how do you start to think about issues like that, right? So if we say that's the entry point, that's the frame I want to be using, well, you need to be a systems thinker, right? So part of this is saying you have to start enhancing your ability to engage in systems thinking. You have to become familiar with notions of complex adaptive systems, and then you have to apply it. At one level, you have to apply the systems thinking to understand the dynamics of structural racism. You have to, at the same time, apply the dynamics of system thinking to understand the health system. And then you have to think, well, what new policies would be developed? And one policy I'll talk about later is a notion of health in all policies, which is not much different than an environmental impact statement that's been used in the environmental field. But then you get to a really sort of frightening reality in our daily politics. We have tremendous fights over what's the role of the state now, and that used to be fairly non-racialized. But the final claim here is that we have to confront the reality that the contemporary antipathy towards government in public action has also become highly racialized. So if you're going to think about a bigger role for the state in dealing with racial disparities, you can't build a case for the government without also thinking about how you undo racism, right? So once again, these things start to be intertwined within the DNA of the problem. All right, so we're going to do a quick run through of the analysis that we do at the Key Center to think about the dynamics of structural racism. And it all revolves around where you live, right? So you can tell the entire story around geography and housing. And sometimes I ask the baseline question, well, what if people were gas molecules? And law students and law professors probably don't know what gas molecules do. But if you present this to a group of high school students, they all get excited because they remember being taught that gas molecules will uniformly distribute within a space. So in a very short period of time, you can sample and you're going to find the same distribution of gas molecules no matter what part of a room or a place that you're sampling. So then the question becomes, why don't people act like gas molecules? Because just even casual observation shows that we don't uniformly distribute. And that's where you have to start telling the social and economic, political stories that have shaped the housing patterns. And I'll get to a map of spatial racism in a minute, but you can start to anticipate notions of redlining, who gets access to credit, who doesn't, what's the role of restrictive covenants. And I like to give people sort of mantras you can take away and sort of think about as you're driving around the region when you can finally leave your house. So start thinking about the spatialization of race and the racialization of space, right? The spatialization of race and the racialization of space, and think about sort of taking a drive through Southeast Michigan, and you start to see that the very geography in which we live has been shaped by race, right? There's another helpful frame to start thinking about. Think about time as cyclical and not linear, right? And think about race as being central to American history and not marginal. And if you start getting in those mindsets, you start to be thinking about dynamic stories and stories of social reproduction that start to get you in a better frame to think about what determines the social and economic determinants of health. All right, so a hyper quick walk through some opportunity mapping, right? And opportunity mapping is just what it says. You define what opportunity is, right? That's the quality of the housing, the employment, the schooling, health system, transportation, food security, and all of those are different aspects of the social and economic determinants of health, right? Anything that can be measured can be mapped, right? So what you do is you take measures of opportunity throughout Southeast Michigan and you map them, right? And the Kirwan Institute did this in 2008, and this is the map that gets produced about opportunity in Southeast Michigan, right? And you can start seeing in the middle of Oakland County, this opportunity desert is Pontiac, right? Go down here, you can start to see almost the entire outline of the city of Detroit as an opportunity desert. That doesn't mean there isn't opportunity in Wayne County. From outer space, you could see the Grosse Pointes as areas of high opportunity. And it's very important to stress, when I talk about opportunity, I'm talking about systems and infrastructure and not individuals, right? Which is another important flip when you start doing systems thinking, right? So this is showing the absence of systems and infrastructure for opportunity that is segregating wealth and opportunity, right? So the baseline then is a segregation in Southeast Michigan of wealth and opportunity. The next slide is going to overlay racial demography in a story in black and white. And you're going to see a series of green dots that represent predominant African-American communities by census tract. And when we wrap over race on the segregation of opportunity, this is what we find, right? And I'm going to sort of toggle back and forth. And if you haven't seen this map before, do get these slides, right? So this, again, it reinforces some things that we all know, right? But sometimes when you spatially map things, you start to get connections that you otherwise miss, right? And I think this is one of the most important maps to talk about racial equity in Southeast Michigan, and yet it's a map that very few people have ever seen. All right, so the claim is then that spatial racism, and that's the segregation of race, wealth, and opportunity, impacts every social policy issue you can care about, right? You can't tell me anything you care about in Southeast Michigan that is not impacted by that map. And all of these things, again, start to influence the social and economic determinants of health. Food security, maternal health, transportation, childhood obesity, water shutoffs, tax foreclosure, life expectancy, mass incarceration, childhood asthma, right? Municipal distress. These are all interconnected, right? And this is what starts to determine the social and economic determinants of health and start to explain why we have that 1441 tragedy that COVID didn't create, but COVID is unmasking and revealing. All right, so deep breath, right? We'll let you all breathe for about 10 seconds. Right? We're now going to start thinking about the dynamics of spatial racism, right? And to give you some frameworks to sort of take this trip through history, right? So the claim is that the social reproduction of oppression is what we started thinking about. We got to think about how, and I'll show later about this dialectic between belief systems and institutions, how the belief systems and institutions of slavery transform themselves into the belief systems and institutions of Jim Crow. right? And then we got to take the train one step further and go to the next stop that says, what is the transmutation of the belief systems and institutions of Jim Crow in the South to give us the forms of spatial racism that we see so well pronounced in the North. All right, so we think about, again, a dialectic, right? We have belief systems, right? And belief systems really create order and meaning in people's lives. Religion functions as a belief system. A lot of ideologies function as a belief system. Politics can function as a belief system. Economics functions as a belief system in our culture. And then the institutions. And the institutions then are the rules, the laws, the norms that govern society. Beliefs influence institutions, institutions influence belief. And if we take that back then to Detroit, you can tell the story of contemporary Detroit, that notion of spatial structural racism, really as the combination of structural racism, which has gone over for centuries, and fiscal austerity, which is really a stark policy you can trace back to the beginning of the Reagan administration, but has continued since. Right? And then you think about belief systems. What are the belief systems behind white supremacy and colorblindness and structural racism? And you can develop an intuition where you're thinking about the belief systems as the internal manifestation of the external institutions, right? And then you can play that same game. What are the institutions of spatial structural racism? What was the role of redlining? What was the use of the GI Bill? There's a great book by Ira Katznelson that when affirmative action was white, and details all the ways in which New Deal programming were intentionally racialized, right? And you can look at the institutions then as the external manifestations of the internal racialized belief systems. And you can do that about fiscal austerity. What's the belief system? What's the notion that you can trust markets, but you can't trust the state? A notion of hyper-individualism, a focus on property and not people, right? The whole tenets that if you're in an international setting, you'd be talking about neoliberalism, all backing up a very strong belief system that then get manifested in institutions, that you cut spending, right? You limit the role of government, you privatize institutions, you cut taxes, right? And then you trust markets because markets can solve any problem, right? That dynamic combined with structural racism in our analysis is what's creating the spatial structural racism that is undermining the social and economic determinants of health within Southeast Michigan, but Southeast Michigan is a microcosm for the country, right? And then when you think that's not bad enough, right, you look at the politics of the last 30 years and you see now what used to just be, we could imagine you could be for or against or civil rights, right? And you could be for or against government. And you could imagine sort of 4 quadrants where you could think about all those combinations. We have now moved to a situation, the claim is here, that our opposition to government is now racialized, right? So we're now going to need new cultural scripts if we're going to be arguing for public space that has to directly encounter notions of anti-racism. And that is conflated in a way that to now even make a case for government in a positive sense means you have to be thinking through a lens of spatial structural racism. All right, that's a lot, right? So that's your quick dynamics into the dynamics of structural racism. We're going to do an equally quick trip through health as a complex adaptive system. Right? So now we've got to think about the entire health system and not the biomedical, but all these dimensions of the social and economic determinants from the same lesson. But you're going to start to see that the methodologies overlap, right? The sort of underlying notion of how systems work apply well in both settings. And that's why I say that there's a high complementarity between a holistic view of health, right? And an analysis of structural racism. All right, so this is what you need. You have to start thinking about health as a complex adaptive system as well, right? And that means that the health system is nested in other social systems, and that's where we're building in then the social and economic determinants of health. Right? And once you recognize the interdependence and the interconnectivity, you got to strive towards greater notions of coherence, right? Some of that is what I call intra-system rationality. How do we make a system more rational or coherent internally? And then you need inter-system rationality. How do you get these systems to be better communicating with themselves? And I use this only in terms of a metaphor, but you can think of a dollar test, right? If I spend $1 more in education, does that get me more health than $1 more in a hospital? Right? If I spend $1 more in public transportation, what's the health impact of that? And any economic system is going to lead to the point where the last dollar I spend in any sector is actually going to produce the same amount of health, right? And the claim here would be that we're skewing tremendously investment in the biomedical sector, right? And we're underinvesting tremendously in the social and economic determinants of health, right? And underlying that has to be starting to be an express ethos of equality and justice, right? We got to start talking about medical ethics in terms of racial equity, and not have this, again, siloed view of what medical ethics even mean. All right, now you've got to have more sophisticated understandings of causation, right? How does causation work in a complex adaptive system? How does racial segregation contribute to poor health and health disparities? What are the health implications of fiscal austerity, right? And these are not things, sadly, that we study, right? Lance Gable and I put together a proposal with community leaders about 4 years ago again, saying we needed to look at the health impact of fiscal austerity in Detroit, right? And nobody was interested in that idea. And again, that whole question of focusing on what determines the social and economic determinants of health. Amy Schultz, who's at the University of Michigan School of Public Health, put together the next slide, which I'm stealing, but I want to give the attribution here. And it's going to hurt your brain, but this is, again, thinking about new forms of causation, racial segregation, and how it works through those institutional space and those belief systems to start saying, how does that impact health outcomes? And you find that it's multi-layered, right? You find that there's mutual causality, there's reciprocal causality, there's time lags in which a change in one policy is going to be manifested in health outcomes. But this is the kind of analysis that's necessary to really get to the root of why COVID is revealing that 1441 tragedy, right? And again, I'm happy to make the slides available. This is a lot to absorb, and this takes hours to even work through what the metric is, but it suggests the notion that we can think about new forms of causation, right? And we're coming down to this notion of really needing to have health in all policies, right? And that's where I'll take you next in just one slide. And again, there's great work that's already been done. Jonathan Heller at Health Impact Partners out in the Bay Area has developed an elaborate process that says, just as you have an environmental impact statement, anytime the public acts, whether that's at the local level and trying to approve a new fast food restaurant, changes in zoning laws, whether it's at the state level, whether it's at the federal level, you can assess the health impact of that policy. And it builds in process and participation into it. So you're actually consulting the people who are going to be affected. And within Jonathan's work is a high sensitivity to racial equity. So civil rights and racial equity is built into the DNA of these kind of health analyses. And that would be one thing coming out of this crisis. You want to say, what could you advocate for in Detroit or in Michigan that would start to have long-term impacts? It would be a health in all policies, right? And that would then impact bringing in health into every time the public is acting. And over time, that starts to realign the social and economic determinants of health. And it does it in every sector, and it does it incrementally in the way that government acts incrementally. All right, but how do we build a new case for public action? And this is addressing the last point, and then I'll stop, is saying that you can't argue for government anymore without recognizing that that is now a racialized discourse, right? And over recent years, we've really racialized opposition to government in a way that prevents a number of very common sense policies that could improve health. And if that's the case, we have to start articulating a new basis for public action. The language I use here, you can argue with, you can modify, we can discuss, but talk about a new ethos for public action that's grounded in a reverence for life and a recognition of our mutual independence, interdependence, and responsibility. That may not be the right language, but we need some language that starts to explain why public action is needed and why that action has to embrace notions of equality and racial equity. We can't have that discussion without having a discussion about race, is my claim. And that we cannot build a case for government without working to undo racism, right? So where do we go from here? And this is kind of the recap slide. We have to merge the objectives improving population health as well as confronting structural racism. Again, the key center, we believe structural racism is the civil rights challenge of our generation, and that the healthcare is the front lines of that battle. And that we have to forge new coalitions and new partnerships that really do focus on what determines the social and economic determinants of health. So, done.
Wow. Well, thank you so much. That was terrific. I'm going to read the one question we've received so far in the chat box. I'm going to urge people to have other questions as well. But, since we're a small group, I think if you'd rather not type the question in the chat box and you just want to raise your hand, not physically, but using the Zoom hand raise function, that's going to work for us too. Whatever works for you guys. In the meantime, and here another question just popped into the chat box, which is great. But in the meantime, let me start with the first one. Can you talk with a little more specificity on what a nuanced framing of a race-centered conversation on government would look like?
Yeah. So part of it is to see, there's a great book that was written again about 4 years ago from Haney Lopez talking about dog whistle politics, right? And was really tracing the evolution of, starting from Reagan, but it's before Reagan, really go back to George Wallace, welfare queen, right? And Reagan never said that the welfare queen was black, right? But that was the common understanding. And that we had this whole growing discourse of opposing government programs because it was helping poor people and black people. Right? Now you look at fast forward to the Tea Party movement, right? And the Tea Party movement, you're no longer using dog whistles, you're using bullhorns, right? And think about that. So I said before that you could imagine I could be for government and against civil rights, right? And you would actually think of the New Deal as that. Remember when affirmative action was white? So I was very pro-government as long as it was helping white people, right? But not black people. You can then fast forward to the Great Society, and you can view Johnson, the Great Society, really as being for government and for civil rights. It was really an effort to take the New Deal template and to expand it to all members of our society. And then you had a backlash, right? A conservative backlash against the civil rights movement, right? And against government, right? And what you've seen emerge is now people are against government and they're against civil rights. And where did that get most strongly manifested? Through Obamacare, right? You go back even, it brings health back into it. Obamacare was really the most serious expansion of governmental authority since the Great Society, right? And the opposition to Obamacare, both as him as an individual, but also as the movement, was incredibly racialized, right? And so this notion about being for government was also being for minorities, right? And this notion now of being opposed to government is now explicitly also involving this sort of racial tension, right? And then you sort of just say that the Trump is a symptom. Trump is not a cause, right? And so what Trump has done is take that pre-existing kind of social dynamics and rode it like a wave. Right. And those are the kind of things that I'm saying that we are now at a point where we can't make a case for government, more education spending, fix the road, stupid. How are we going to come back and imagine meaningful action on the social and economic determinants of health that would undo structural racism, advance racial equity. Now we have to fight for racial equity at the same time and in the same language and with the same advocacy, storytelling, narratives, model, values, communitarian principles that we would also fight racism, right? So again, the claim is that the case for government, since it's been racialized, has to now equally be conscious of advocating for government, but also advocating for racial equity.
I'm reminded here as well of Will Kamlicka's work on the connection of support for government income redistribution with racial homogeneity in society, and we're getting back to the same issues.
No, and that's longer than the existence of America as a country, and sometimes it's called the racial wedge, right? And the whole notion is if you said vote your interests, right? In theory, the interests of all poor people would have a whole lot more in common. And for centuries, we've been manipulating race to create racial wedges to make sure that we create divides between poor white folks from poor black folks. And that's very much part and parcel to this whole discussion.
I see we've got a virtual raised hand from Professor Gable, so I'm going to let him into this conversation.
Well, I thank you, Peter. This has been a really fascinating discussion, and I wanted to just raise one particular, very specific thing that is concerning me right now that kind of builds on what you were just saying. in terms of where we are with the backlash to some of the government efforts to intervene to stop the spread of COVID-19, we're starting to see more and more protests and legal challenges to especially governors using their powers to try to keep people at home or to close businesses or otherwise stop people from interacting. And down the road, as we start to emerge from these more restrictive orders into a place where we have less restrictions and more engagement again, but where there are still limitations. One area that really worries me is the enforcement of those limitations. And so, if you have a rule now that everyone must wear masks if you're in a public place, who is that rule going to be enforced against? There was like a quick article that I saw, I think in the New York Times the other day, talking about how of the 40 or 50 people that had been cited for not wearing masks in New York City, virtually all of them were people of color. And so I mean, this fits in with everything you've been saying, but I wanted to flag that issue in particular as we move into this area where we're going to start potentially enforcing violations of these new rules that we're putting into place.
Yeah, no, these are great questions. First, I just say that the part of the thing about the belief system, and this is taking the tangent you said earlier about the protests. Belief systems, when they come under challenge, often get stronger and more vocal and self-defensive, right? And here I'm thinking in particular this overlay between kind of fundamentalism in terms of religion, anti-science, right? Is coalescing in many ways, and the more positive way you could see it is that belief system that is held by an important part of our population is actually under great stress. And what's happening to that belief system is not much different than other belief systems historically that have been through great stress, but it also makes great volatility. So I think there's one aspect of the story is how do we see the sort of anti-climate story, the sort of anti-government, this hyper-individualist, this strong assertion of religious rights in a way that's not sensitive to even religious communitarian values. So there's that aspect that part of this conflation of racism and anti-government has much deeper sort of notions about plumbing the depths of what is the belief system behind that kind of word. So now we got dogs, so they like that question. All right, we're going to keep them down. But to your point about needing to worry about structural racism, express racism, as we're actually implementing public health policy is incredibly important. I've seen data similar to yours, that the people who get cited are just the people who get profiled for police generally. Stop. And that's real. The kind of notion was that 80% of the people cited in New York were Black or Latino, whereas in Manhattan for white people, they were handing out masks, not tickets, right? So you don't get cited, well, here, you forgot your mask, here's a mask to take care of yourself. We're having a Deal 5 session tomorrow about COVID, and I'll talk a little about what I did here. But one of our team members is a leader on the Project Greenlight and surveillance, right? And what she's raising is, at the same time, under the guise of public health, under this notion of surveillance, we're actually severely extending the security state in ways that are going to disproportionately affect Black and brown Detroiters. And so building a sensitivity about how we fight, how we protect public health, but how we are making sure that we're not reproducing the systems of oppression that led to the disparate impact becomes incredibly important. So that's something that we just have to be very diligent about, because it's already happening. We're predisposed to view the world in a racialized way. And now when we actually are using state power, right, we're doing so in a way that's racialized, right? And I make one caveat: the only sector that has not shrunk since the Reagan administration has been mass incarceration, right? So the only area of aggressive public action, again, has been highly racialized in the use of state power and state authority.
So here's a new question. There was no political will to address racial disparities before the COVID-19 crisis. How can we hope to address any of this in what will surely be months or years of fiscal austerity in the aftermath? Already, There's a 25% cut planned for public education funding, which will, of course, have an outsized impact on communities of color.
Yeah, no, so again, great questions. And you're sort of anticipating the new challenges, you know, and people don't connect the dots, right? So we had this whole navel staring exercise about why is Detroit suffering so badly? Why is 14% of the state population suffering 41% of the deaths? And then a week later, we had the press conferences about all the budget cuts that are going to happen in Detroit, right? And so we're not even connecting the notion that within almost the same news cycle of decrying the severity of the public health dangers created by spatial structural racism, we're now going to exacerbate the spatial structural racism by making sure that the city in crisis is going to have even more fiscal austerity. And so it's a real dynamic. If you would ask me as just a prognosticator, we will forget about COVID and race as quickly as we forgot about race and Katrina. Right? The same notion that something that stresses an entire system reveals these deep structural inequalities and we all feel bad about it, and then we forget about it, right? So it will take effort, right? And that's also, so I say that we have to be wise enough to say that our fight for roads is also a fight for racial equity, and that we have to start advocating for a different set of values. Which is also why the health in all policies is not a racial equity impact statement, right? If we were true methodologically, I would end this with saying we need a racial equity impact statement on all government policies. And you want to know the chance of that happening is less than zero, right? And so we got to think strategically. It's much easier to build a consensus around health in all policies, right? And then to build in the racial equity values in the context of defining public health as a way to be advancing the ball, right? So think strategically, but more importantly, we need fundamentally different orientations towards community. And that is some of the work that John Powell is doing at the Haas Institute, thinking about terms of othering and belonging. And that notion that look at the dynamics of othering and look at race through the lens of othering and belonging. And then he combines this notion of expanding the circle of human concern, right? And that's echoing with Dr. King's language about a beloved community, which is really saying that we need to be thinking about who we are as a community. And I think the COVID crisis creates a point of introspection. So maybe I shouldn't be as cynical as I was earlier. We are at a deep point where we're saying we all are going through something. The frame of public health is imposed upon us, where we start to see our actions do affect others, others' actions affect us, and that I can't be thinking in a completely individualistic sense. So if we were actually layering the template of greater communitarian values in our response to COVID, which we're not, right? We're not using new language, we're not telling new stories in a self-conscious way. If we started doing that, we would be laying the foundation for the kinds of social policy changes that would be necessary, even in an era where we're all tightening our belts, you know. But a great question, and that's the reality check, you know, and that's why this problem has been with us for 500 years, and it's not going to go away in 5 years, and we have to sort of have that time frame as part of our armor as we fight this fight as well.
Questioner asked, can you talk about internalized racism and how that affects minority populations' desire to seek healthcare?
Yeah. I was with you until I got to the very last end, right? So I'm not sure I would necessarily, without further discussion and thought, necessarily say that internalized racism, which is a real thing, is necessarily high on my list of why African Americans don't seek healthcare, right? But I'm open to thinking harder about that. Internalized racism is real, right? And I don't know if anybody's taken the Harvard implicit bias test. But you can do that online. You've got a lot of time at home now, so you can all, your homework assignment, Google Harvard implicit bias test, take it. And what you find, right, is that there's very strong empirical evidence, if you buy into the methodology, and again, always think skeptically as well as empathetically, that European Americans harbor deep implicit biases against African Americans, right? And it's measured by the fact that it's a time differential test. It takes white people much longer, relatively speaking, to associate positive words with African American faces, right? We're very good about associating negative words with African American faces. We can associate positive words with European American faces, and we have a hard time associating negative words with European American faces, right? And that's sort of one way just to get insight into the belief system of our society is something that we are products of and we internalize, right? And nobody is immune, right? And so again, I'm going to raise up John Powell as another person you should be reading. What John would say at this point is, does that make you a racist, right? And he'd say, no, that makes you a human being, right? But a human being with work to do, right? But that same test shows that a very large percentage of African Americans harbor a very strong implicit bias against African Americans, right? So just as we are products of, as European Americans of that racism, African Americans often internalize a lot of that as well. And that's a real thing. My current reading is reading a book called The Enigma of Clarence Thomas. So I've been doing a lot of thinking about internalized racism in the African American community as it gets reflected in the jurisprudence of Clarence Thomas. And I think if you empathetically engage him, and I think you do need to empathetically engage him and not just dismiss him, I think that part of the story of Clarence Thomas is a strong internalized sense of racism. And that's certainly not all of it, but I think that that's part of the story. If you were to ask me why African Americans are less likely to access the healthcare system, which is another empirical phenomenon, start with a lack of trust, right? And that lack of trust is historically justified. Black women's bodies were used to experiment on, and literally experiment on, in the growth of the field of gynecology in just horrific torture-based ways. The Tuskegee experiment that I mentioned coming out where they intentionally inflicted men with syphilis and failed to treat them when treatment was available to watch the development of the disease until death are all real parts of history. And so this notion that you trust the person in the white coat, you know, makes sense if you're a white person, does not necessarily make the same sense in some other communities. If you look again about implicit biases, some of the better research is done in the criminal justice field. So you can find all these sort of shooter bias stories about how police respond to implicit bias and racial stereotypes. You find that in education, right? So teachers do the same damn thing. And then you find it in healthcare. Those are the most studied and most prevalent places. So if you are Black and you do go to the hospital, you're not going to get the same pain medication, right? You're not going to get the same diagnosis. And I've heard tremendous numbers of stories of people talking about themselves and talking about members of their family, African Americans in Detroit, who would go presenting with symptoms and were told it's not COVID or it's not serious enough, right? And so even when they do get there, they don't get the same treatment, which again is a whole other system of trying to deal with explicit and implicit forms of bias within the healthcare system, which are incredibly real. And so part of the discussion post-Flint water crisis, right, was how do you get people of Flint to trust the government, right? Because it's that reinforces this whole stereotype about they're not here to help us, right? It's not the same treatment, right? And the same discussions have to be present in thinking about how to deal with issues of access and getting people to the hospital when they need care with this sort of notion of high levels of distrust.
Questioner asks, how essential would you say it is to focus on the negative effects of racism on white people in this kind of conversation?
Yeah.
To use this kind of self-interest to counteract what would otherwise be viewed as a charity frame.
Yeah. So how to address racism in the white community is an incredibly important question. And I don't think that first we haven't asked and explored that question as aggressively as we should. There have been different attempts, right? So one notion has been to focus on privilege. And I think that helps with guilt-laden liberals, but that doesn't help with poor white folk. So I think that there's a role for discussions of white privilege, but I view these as tools in a toolbox, right? You always got to make sure you're using the right tool for the right purpose. So a discussion of privilege is helpful in some places. I think it's particularly helpful in younger people because it starts to get them on a journey, and this has to be a personal journey. It's not something that's externally imposed. To start questioning with their own life experience and whether that's been influenced by the privileges of their own race. You know, there's some discussions about being much more explicit and trying to frame what are the negative aspects of whiteness, right? And there are many. People became white in this country. White is this incredible social construct, but to become white, you were no longer German, right? Or you're no longer Lithuanian, or you're no longer Italian. So what it means to be white is actually to live without a culture, right? To live without a history, to live without recipes, right? To live without music. And there's all sorts of ways in which the construct of whiteness, I think, has inflicted different kinds of damage, right? And I think that those are worthy discussions to have. There is you talk to any community organizer, they're going to tell you you're wasting your time if you can't match your ask with self-interest, right? So if you're not appealing directly to the self-interest of your audience, your chance of persuading somebody is pretty small, right? So again, it's the right kind of question to be asking. You have to be sensitive to what audiences you're asking it to. But I think you have to start thinking very seriously about the many ways in which addressing racism is in many people's interest. I won't say everybody's interest, because there are ways in which addressing racism are going to be counter to interest. And when you're meeting the people who addressing racism is counter their interest, go back and listen to Dr. King's speech about why patience is not a virtue, and why you don't wait to demand justice to transform the hearts of the oppressor.
This isn't directly responsive to the question, but one thing the question brings to my mind is, it seemed to me the presentation smushed together two concepts that might usefully be pulled apart. One of them is racial disparities in healthcare outcomes. The other is, aggregate healthcare outcomes across racial lines, because it's sort of obvious how structural racism is going to lead to racial disparities in healthcare outcomes. It's also, I think, pretty clear from your presentation that structural racism is going to lower aggregate healthcare outcomes, even if they're measured across racial lines, to the extent that bad healthcare outcomes result from things like living in opportunity deserts. And the only reason that we allow opportunity deserts to exist at all is because they're populated primarily by African Americans in the context of structural racism. So that's just a thought that may or may not generate some response.
No, I think that's true. One of the any social policy that you can define geographically is going to lend itself to incorporating the whole histories of racial disparities, right? So think about school districts, right? And if they're not my kids, I don't have to care about them, right? And sadly, we know empirically, if they're not your kids, you don't care about them. Think about the auto insurance rates, right? Which again permits rates to be calculated on a geographic unit. So one of the intuitions out of this is really looking for opportunities to disconnect geography and policy, right? And one of the things that does is changes the political dynamics of the constituents of who has to care. And again, this requires getting used to be thinking in new ways and thinking about deeper interconnections. And I think that intuition is a very strong one, which would come back to have influence over all sorts of different ranges of policies and programs.
Question, building on Professor Gable's question, if you all remember Professor Gable's question. What's your response to an anti-government yet pro-civil rights perspective because of the government's role in perpetuating structural and individual racism?
Yeah, again, good questions, and sort of greater context is always helpful to try to think about, different ramifications. First is we have to get to a point where we can understand people's differences, right? And so I always encourage my own students to go through two cycles. One is to engage empathetically. We're actually trying to understand somebody on their own terms and their own arguments. And then again, we're training lawyers, right, to then engage critically, right? Are we persuaded by that? Is that real? I can be sympathetic to why, for different reasons, people have a principled case against government, right? But then I would have to say, well, again, we have to think in a much more nuanced ways. Does that mean no roads? Does that mean no education? So there's a wide range of different notions about what is the right role of government, which is probably a much healthier way to phrase the question than pro or anti-government. As well as, you know, and I think that the question is pointing at more of a libertarian tradition of somebody that, you know, is very rights respecting, right? And there's a healthy space where you can have a dialogue between different sets of values and principles as applied to different sets of policies and programs. And part of getting out of our current moment, right, is to create space to permit those kind of dialogues, right? And to do so in a way that where dialogue itself is a skill, right? Which is another thing we do in our Detroit Equity Action Lab. And lawyers, sadly, are not taught about dialogue, right? We're taught about debate and discourse, right? And dialogue is a very different phenomenon. In a dialogue, which often happens is people just speaking one after each other, not responding to each other. The notion is you're collectively building a bigger and different understanding than you ever could individually, right? And so one of the other things coming out of this is we're trying to think about new skills and new practices, really is to look at dialogue as a skill that we can practice, and you need to practice it in settings where there's tension, right? Maybe not your first time, but that's again where you, one of the other skills that you're gonna have if you're doing this work is to sit with tension, right? And I would say this sort of speaking as a white males like to solve problems immediately, right? Even if the problem can't be solved immediately. And so one of the skills that I have to learn is how to sit with tension and not try to intervene in every situation to try to get a false resolution. Right? So there's a whole bunch of ways that we can really view this kind of work is entailing different skills, which is great because skills can be taught and then skills can be learned and then skills can be practiced. And at the end of the day, at some level of this social transformation is going to require a whole bunch of individual transformations, right? So there are different things that people can pull out of this and then try to work within yourself about how you apply this to your life principles. And I think if we're all doing that, we're going to come better when we're going to get back the state budget and come to a realization that these are going to be hard times following this crisis. And that we're going to have to think carefully as a community about how we respond to those hard times.
Okay, that is the end of the questions folks have dropped in the chat box. That's the end of the raised hands. It is also very nearly the end of the hour. So we have just about filled our hour with what I thought was an absolutely terrific discussion.
Great.
And so I'm going to thank Professor Hammer. I'm going to thank all of you guys. And I'm going to remind you that this presentation will be made available online on the Wayne Law website as soon as we can get it closed captioned. So tell your friends they can still watch. And thank you all much. Thank you very much. That is it for this episode of COVID-19 Town Halls.